This section is about special populations. First of all, we'll be talking about a client with high blood pressure. A client with high blood pressure should not lift weight above their head, elevated. Instead of doing push-ups when they're on the ground, lying on the ground, they can do it on an incline bench or against a wall. Doing things like chest press exercises can also be on an incline. Probably would recommend that these sorts of clients use a lighter weight in exercises than having very heavy weights and straining themselves, which can also increase blood pressure as well. We need to make sure that these clients warm up and cool down properly to reduce the risk of any spikes in their blood pressure. If we were to go to do any innovative cardio such as boxing like we showed today, we should keep it at a low intensity just so we can maintain the heart rate at a lower level so it doesn't spike as well. Moving on to the next one, we'll be talking about a client with lower back pain. Clients with lower back pain, for instance, if we're doing push-ups, we can also do them on an incline or against the wall instead of having their body straight out on their toes and their hands as a standard push-up. We can also then drop, if we were going to do them on the ground, we can also ask the client to do them on their knees as well, so that then takes out any strain on their back, any part of their back. A single arm row using a bench for support is much better than a bent over row, just because you have your body which can then be supported on that bench itself, which reduces the amount of stress that's on the client's back. Things like squats, we can ask the client to do the squats, but we can just instruct them not to squat so low as well, or with weight, or trying to do barbell squats, because obviously that can put pressure on the back as well. So we can modify those exercises to, say, a light weighted lunge or just a body weight lunge itself, and make sure that we need to instruct the clients to brace their core when they're doing these sorts of exercises as well, because obviously we all know that the core itself supports the spine and the back. And finally, in special population, we'll talk about a client with a knee injury. Things like push-ups can still be done, but we could maybe double over a towel under their knees if they were going to do that, or a pillow or some sort of cushioning as well, or like in the last two, we could just convert the normal push-up into a wall push-up or an incline push-up. Obviously with squats and lunges, what we're going to try to do is squat, but obviously that puts a bit of pressure on their knees, either when they squat not to go as low, or and to make sure that they don't extend their knees over their toes as well when they're attempting those exercises. Lower impact exercises should be taken, so whether if the clients enjoy running, we can go for a run on a treadmill instead of running on the road, where it's much more high impact on the client's joints. Low impact also can lead to going to a swimming pool to do obviously water exercises, obviously, because that takes a lot of weight off the client's joints as well. Apart from that, we need to just maintain overall in special population, we do need to do our pre-exercise questionnaire. We need to understand what the client's problems are or things that we can assist with. Like what we learned in our assignments, if we are in doubt in regards to special populations, we can always refer them. That's it for the special populations segment of this.